So one of the studies that we've been conducting here at the Princess Margaret Cancer Centre, and we've now expanded to other sites in Canada, is a phase 1 study of Binimetinib, which is now a known and approved MEK inhibitor in combination with Pembrolizumab. There are some great preclinical data indicating that this combination may not only be tolerable, but can really activate a T-cell activity. And in particular, we know that even in patients with PD-L1 high lung cancer, that Pembrolizumab alone is still associated with a less than 50% response rate. And so our question in the study was, can we figure out what MEK inhibition could add to this to improve outcome? We presented our phase 1 data at the European Lung Cancer Congress this year, and in particular, I want to give a shout out to Dr. Chris Terrio, one of our internal medicine residents who's helped me work on this and was first author on the poster. So we included 11 patients, and our recommended phase 2 dose was 30 milligrams twice a day, which is a little bit lower than the single agent dose, plus full dose pembrolizumab, 200 milligrams intravenously every 21 days. Patients actually tolerated treatment relatively well. Rash in particular was the most common side effect related to Binimetinib, and we noticed a partial response in 4 of our 11 patients, or 36%. In particular, our patients with KRAS or BRAF-driven tumors were the most likely to respond. So we saw patients with KRAS G12D, G12A, and G12V alterations, and also a patient with V600E who was a non-smoker, who also had dramatic response. Interestingly, in our patients that did not have RAS or RAF alterations, response was much less likely. And of course, all of these patients had a high PD-L1 expression. So there did appear to be an early trend of patients responding to combination treatment, in particular in those with RAS or RAF alterations. And I think that's so important as we continue to work to move beyond patients with BRAF V600E or KRAS G12C to find better ways to treat their cancer. We're continuing to expand this cohort, and we hope to present more data from our dose expansion in the coming year.